Why are cities important? And why should we care about getting city regions right? Watch the Urban Queue to know what it takes to shape a city that works for all. Hello, everyone, and welcome to the Urban Queue. Today, we are in conversation with Dr. Inés Sánchez de Madariaga. Inés is UNESCO Chair on Gender in Science, Technology and Innovation, Professor of Urban Planning in Madrid, and Chair of the Advisory Group on Gender Issues to the Executive Director of UN Habitat. She's a leading international expert on gender in transportation, urban planning, architecture, and STEM, with extensive experience in policy, practice, and research. As a member of the European Commission Helsinki Group on Gender in Research and chair of the EC Expert Group on Structural Change, she led the negotiations to introduce gender as a central element of the EC research program Horizon 2020. She has a vast body of work around the mobility of care, and we are here today to find out more, to talk about cities, people, and how do we plan for and get to truly inclusive, people-focused urban areas. Welcome, Inez. It is an honor and a pleasure to have you on our podcast, The Urban Queue.
Thank you. I'm very happy to be here with you today. Thank you so much.
Fantastic. So I will start by asking you the question about livable cities. How would you define a livable city? And according to you, which is your favorite city in the world?
Well, I would say that livable cities are cities in which everyone can lead their everyday lives in a reasonable manner. That is, that people can access the places they have to go every day, which is places of work, but it's also the places where you do all the other things necessary for the upkeep of life. And for the care of other people who cannot maybe go around by themselves, that you can access those places in reasonable times and at a reasonable cost and sufficiently conveniently, that it's not too difficult or too dangerous, and also that these places exist so that the facilities for the services that are needed for a life where you can have an education, health, work, culture, sports, these facilities are there, and also that there is employment through which people can gain the means by which to sustain this life. So, and then of course that there is open space where people can walk and take make some physical exercise. Where all these things are relatively accessible and they are there for everyone.
Great. And what about your favorite city in the world?
Yes, well, I like big cities. And in big cities, sometimes things can be a bit difficult and many things are not close. But big cities, and that might be a bit contradictory with what I have just said, but big cities have this complexity, this diversity, and have extraordinary things that you don't find in mid-sized cities. So I like this bustling and for instance, I love New York, and I love the big cities around the world, the cities where you can find all sorts of strange things happening there. Yes, it's a bit
That's
contradictory with the previous thing.
No, it's not necessarily contradictory because your previous answer, you basically talked a lot about access, right? Access to wherever you want to go, wherever you need to be, and cities that sort of facilitate interaction, that facilitate, access to services. And big cities can sometimes do that. New York, like you gave, is a great example of a city that kind of facilitates that through mass transit and the infrastructure and walking. And so access seems to be a big sort of underlying concept in the work that you do, and therefore you had coined this whole concept of mobility of care in 2008 while working with the Spanish Ministry of Transportation, and you highlighted basically how care and employment are or should be equally important in transport planning and policy. So can you tell us more about the concept of mobility of care, and does it impact all genders? Does it
Yes.
impact men, women equally?
Yes, it does impact everyone because the concept of mobility of care is addressing issues in the city and in transportation and in mobility that are relevant to to those tasks that are related to gender roles, independently of whether it's men or women who do those tasks. Because bringing kids to school can be done by men equally, exactly as women do it. Although we know that the fact is that statistically it's women who do that type of trips. So I coined the mobility of care when I was doing this research project for the Spanish Ministry of Transportation, in which they asked me to analyze the main transportation service statistics that existed in Spain at the time from a gender perspective, so that they could improve the data and hence, as a consequence, improve the policies. So I found a number of biases in the ways the data were collected. And at the end, I saw that the purposes of travel that all these surveys were considering, which, by the way, are very, very standard categories for classifying travel purposes. Visiting, strolling, escorting, shopping, black box others, and then, of course, employment and education and leisure. So when I saw this, after having finished the study for the ministry, it came to my mind that this concept that was a core concept of feminist and women's scholarship, which was the concept of care, which refers to the activities that adult people do for the maintenance and the reproduction of life on behalf of others, was, in fact, could be understood as the concept that could be an umbrella concept under which all these trips that seemed unimportant because they were under categories that were relatively smaller, like escorting, shopping, strolling, visiting, and even others, and some of leisure too, were really trips that people do so that the life can go on, can be reproduced, that the household works, that the things that you need to have in the house, that food is there, that kids go to school, that grandmothers and grandparents can go to the doctors, and all these things that are needed on a daily basis, which are called care tasks and are linked to the idea of gender roles and gender and the sexual divisions of labor and so on. So I thought, if we give all these trips this umbrella name, we can really quantify the trips and see how many they are in the total of trips. And I'm sure, and I thought surely there will be almost as many as as trips related to employment. And we could also make them visible because we would see that they are a very big part of all trips. And so that's what it came out when I did a specifically designed survey, applied it to Madrid, in which we saw that actually care trips were almost as many as trips related to employment. And also that it was women who actually were doing them in an absolute majority of the times.
Right. So, Ines, for the listeners of this podcast, you're talking about making certain kinds of trips visible. So, can you tell us that, how basically a better understanding of the way different people navigate cities, the way people travel for different purposes can help city officials tap into opportunities and, help them tackle inequality in cities in many ways?
Yes, because if we can understand all these trips that and we see that there's a correlation of this kind of trips with a group of people, which is women, we are seeing that women's and men's mobility are very different because men's mobility tend to be of a pendular kind, commuting time to a kind to from home to work, and then maybe to some sports. But women's mobility is of a polygonal shape closer to the home, using more public transport and pedestrian trips, more chain trips, less access to cars. In India, even less access to the subway because women cannot afford to pay the subway. So we can, by looking this way to transportation, we can have a better understanding of the very specific realities and needs and transportation patterns of different groups of people. So policy will be improved because the data is better. It will be more based on empirical evidence, more based on more valid, more relevant data. And so the policy can be more targeted, can be more specifically addressing the real problems of men and women.
Right.
in the reality of what they need with respect to transportation systems.
Right. No, absolutely. So, if I move to the Indian context for a minute, in India, we've had an unfortunate trend, and possibly around the globe, where women's workforce participation rate has slipped. So, pre-pandemic, it was somewhere around 24%, still very low. And now, post-pandemic, it's 19% and has had a hard time climbing back up, largely due to burden of care and access issues, or where if you're walking outside, the walking conditions are inhospitable or the jobs are not located close to homes. And you talked about how women make all of these polygonal trips, right? So how can city planning address the gender needs and be more inclusive? You talked about policy and mobility policy, but how can city planning basically address this, and how can we start to translate this concept on the ground in Indian cities? Whose job is it to basically take the data and the analysis that it presents to make it functional on the ground?
Yes, I think it's a job of everyone, of all the stakeholders. It's a job of academics by producing the study, the research, which also governments do. So governments also have to produce studies, research, but then governments and specific agencies working in the transportation sectors, and even those who build the cars, the trucks, and so on. So all the stakeholders need to look at their part in the policy arena. So and they need to look at what are these travel patterns which are different, and how the options in terms of public transport can be put in place that better address those different travel patterns. Then the issue of safety, which it's very much in the agenda in India, but it needs to continue to be addressed, because safety is a key issue for women's mobility. But travel patterns, looking at these care issues and how how mobility of care can combine with mobility related to employment. This is the key thing that it's like a new area to look for policymakers. So where are employment locations? What kind of employment sectors can be or should be supported so that more women can access employment? And this in combination with education, of course, because women need to have the skills for different employment. So you need to it's a different sets of policy areas that need to be looked at in combination, so that women can get better access to education, can get better support for their care tasks, can have better access to employment, both physical access through transportation, but also access to employment through policies that support access to jobs for those who also have care responsibilities. So the way the workforce and the labor force policies are addressed is also very important, so that this very low rate of women's participation in the labor force can be addressed.
No,
But
that's
the transportation sector, by the way, is a sector in which there's big opportunity of employment for women too. So that's a specific area that could also be addressed by transportation agencies.
No, absolutely. And I think, when you're talking about the kinds of jobs, and your UNESCO chair, it's also you're looking at architecture, you're looking at STEM, you're basically looking at access to jobs and in transportation, and how mobility plays a key role here. So, lastly, let me ask you sort of a creative question. If you were, say, an Indian key city stakeholder with lots of powers, what would be the three things or the three changes that you would make to make the cities here in India more inclusive and welcoming for all?
Well, I think that the first one would be streets and sidewalks. So public space in which it's safe to walk in the streets, that it's not only safe but also convenient, that the street has a quality, and there's an interconnectivity and continuity of public space. That would be the first one. Then the second one would relate to the transportation infrastructure itself. Indian cities are very big cities. Delhi is an enormous city. women have free access to buses, but buses are not as reliable as metro. So I would say, and then the metro system is not economically accessible for so many women. It's not accessible for a big section of the population. So I would say that extending the metro and finding the ways to make it more accessible in economic terms for women would also be a key issue. And then, of course, having certain infrastructures that would support care tasks in neighborhoods and close to centers of economic employment would also be part of it. All of this requires urban planning, absolutely, and an idea of how to build public space. And I would say that public space is not what the place to look at what's quality public space. We know that from urban design, and there are so many great examples around the world of good quality public space that there's nothing to be invented. But it's like uh, like putting a greater effort in that part.
Right. No, and it's not to be invented, but still our cities lack a very basic infrastructure like that, right? So absolutely right. I mean, public spaces, urban planning playing a major role in sort of this long-term intervention and thinking and policy around, having inclusive cities and basically compact cities. I think that those are the things that I'm taking away from, this conversation. Also, the fact that you're talking about everyone has a stake in creating inclusive cities. So whether you're a producer in the city, a consumer of the city, in the city, everyone has a stake in that. Um, Thank you very much, Inez, for that insightful conversation, and congratulations on the fantastic work you're doing on
Thank
urban
you.
transformation. And
Thank you. My pleasure.
yeah, good luck to you for making many more strides for us women and gender and inclusion all over the world. Thank you so
Thank
much.
you. Thank you. Thank you very much. It's been my pleasure.
Thank you.
Thank you. Bye bye.